Hello and welcome everyone to our digital Infoday session about planning ahead and end-of-life issues. In this webinar, we will be talking about what support is out there, along with some practical steps to help you and your family understand more about symptoms, options and preferences that there are when myeloma treatment ends. It can be a difficult topic to think and talk about, both for patients and their loved ones, but we feel that it's important to cover it. If at any point you're not ready to hear what we discuss, you can leave at any time during the session. The recording of this webinar will be available to watch on our Facebook page and on our website soon, so you can always come back to it if you feel ready and able to do so. The structure of this evening's webinar will be a presentation where we will hear from each of our speakers in turn. This will allow time and to be followed by a question and answer session at the end. I'd like to say many thanks to those who have already submitted questions to us, but just so you know, you can always submit questions at any time during this live event. We will try to get through as many of these as possible during the Q&A section. If you have a question but would rather not ask it during the evening, or it comes to mind after the webinar is finished, don't worry, that's okay. You can always talk to your haematology team or get in touch with us at a later date. If during the webinar you'd like to chat with each other, you can use the chat box. And if you have any questions for the speakers, please use the Q&A box at the bottom of your screen. So to introduce myself, my name is Kim and I am one of the myeloma information specialists here at Myeloma UK. Part of our role is to offer support and information, and we often take telephone calls and respond to emails as patients and family members get in touch with us. So please do contact us anytime if you have any questions or concerns, or would just like to share your thoughts out loud with someone. At Myeloma UK, our work is always patient-focused, and we aim to empower, inform, and support patients in everything that we do. As an organisation, we rely on the generosity and kindness of our supporters, fundraising and donating. Myeloma UK receives no core government funding, so all of your support is vital. We are truly thankful for all the contributions we receive, as they allow us to continue working to help patients, their families and friends. So now I'd like to introduce and welcome this evening's experts. Ashiq Ahmed, who is a consultant in palliative care and the clinical lead for supportive and palliative care at the Manchester Royal Infirmary, Manchester University Hospitals NHS Trust. And also I'd like to welcome Surabhi Chaturvedi, who is a psychotherapist and counsellor in the Department of Haematology at King's Hospital NHS Foundation Trust, London. In addition to our two experts, I will also be speaking this evening. My professional background is predominantly in specialist palliative care and support and hospice nursing. Thank you both again for speaking with us this evening. And Ashiq, I'd like to hand over to you first to start off our presentation.
Hi, thank you, Kim, for inviting me to this talk, and thank you everyone for attending this session. So I'm going to talk to you about end-of-life care in patients with myeloma. Next slide, please. So I'll start with some of the statistics. Myeloma is the 19th most common cancer in the UK. Over the last decade and a half, there's been a huge amount of research. Unfortunately, as a result of that, a lot of myeloma is now treatable. However, unfortunately, some patients do succumb to the disease and do die from the condition. So it is important that for those unfortunate patients, then they should get good end-of-life care as and when they approach the final stages of life. Next slide, please. So, and this is where palliative care can play an important role. Palliative care is care of people with chronic life-limiting conditions, including conditions such as myeloma. The core emphasis of palliative care is around quality of life. It is a holistic care approach whereby you have the medical team focusing on the symptom control of the side of things, as well as other allied health professionals like psychologists, social worker, as well as the chaplaincy team who will help provide the psychological and social support for people with myeloma. Now, palliative care does not just look at end-of-life care. If you have got symptoms early on in the disease, even at the point of diagnosis, then palliative care can well be involved just to improve the symptom side of things. But for the purpose of this talk, I'm going to concentrate on the end-of-life care aspects. Palliative care also helps with advanced care planning, which is kind of planning ahead, which I will come to at the later part of the presentation. Next slide, please. So what are the symptoms that patients often encounter when they're approaching the last weeks and last days of life? The most common symptoms are listed in the presentation, as you can see. Some of it could be pain. Some patients can experience severe pain, either from the myeloma itself or from the consequence of the treatment of myeloma. Some patients can be very fatigued and can develop severe breathlessness. Others can experience a degree of nausea and may become sick. Patients who are in the last days of life can feel a bit agitated or confused. And when you're in the very final stages of life, there might be fluid building up in the lungs, as a result of which you might have build up some secretions. Now, these are a combination of symptoms. Not every person needs to go through this. Some patients may have some of these symptoms in varying degrees. Others may not experience any of these symptoms at all. But the key point to consider or to remember is that we are there to help you if and when these symptoms develop. Next slide, please. So going on to the specific medical management of these symptoms, one of the key pain relief measures that we use is opioid-based medications or morphine-based medications. There are a variety of morphine-based medicines that we would use under such circumstances. Now, I want to emphasize here that we would use it in a very scientific manner, just the right dose for the right condition, for the right symptom. And they would be monitored on a regular basis. If someone is feeling sick, we would use a class of drugs called the antiemetic drugs. And there are a variety of these medicines that we would use, again, tailored to the person depending on the type of symptoms. If someone is feeling very confused or agitated, which could either be due to imbalance of salts in the blood, especially the salt called calcium, which in some myeloma patients can be very raised, or due to an infection, under such circumstances, alongside trying to correct the imbalances in the salt, we would also consider anti-agitation medications, or most commonly called as antipsychotics. And we would also use anti-secretory medicines for any secretions that might develop as and when a patient approaches end of life. Now, the medications can be given either in a tablet form or a liquid form or as an injectable. There are some opioid-based patches available for patients if that is appropriate. We also use something called the syringe pump or the syringe driver, which is what's shown in the picture there. It's a small but very effective device through which we can deliver up to 3 drugs at the same time. So if someone has got, let's say, pain, agitation, and sickness, we can just use one small, simple this device to deliver effective management of all those 3 symptoms. And the good thing about the syringe driver or the syringe pump is that it can be used in a hospital setting, but also can be used in patients' homes, which the district nurses can deliver that. So even though there may be some symptoms that patients might suffer from, I can assure you that there are effective managements that we can do to help with those. Next slide, please. So we touched upon advanced care planning. Well, advanced care planning is what we call as planning ahead. So if a patient has reached the end of line of treatment, you've gone through 4th or 5th line of treatment, and unfortunately the myeloma has got worse despite that, then it's important to have thought about what is it that you would want if and when you're approaching your final weeks or months of life. Where would you want to be if you are approaching that stage? Would you want to be in hospital or a hospice? Would you want to be referred to the community Macmillan nurses who will help you improve your symptoms if and when that happens. You can also discuss with us about avoiding unnecessary hospital admissions. Especially if you're having to go back and forth to the hospital for blood transfusions or antibiotics. There are other measures that we can provide either in a community setting or in a hospice setting to avoid unnecessary busy hospital admissions. And we can signpost you to the financial affairs or supporting the family while you're going through this phase. So advanced care planning is something that we can help you with. And it is also something that it's important for you to consider if and when you're approaching those end of line of treatment. Next slide, please. So we talked about preferred place of care. So if you're approaching those final stages of life and you're thinking about what is important to you, it is also important to look at where would you like to be when you are approaching the dying phase. Would you prefer to be at home? Some people will prefer to be in a hospice, or there might be others who are already in a care home while undergoing this condition, or others might end up in a hospital during the final stages of life. What we can assure you is that we can try our very best to facilitate your preferred place of care, and whichever setting you are in, you will have access to a palliative care team, be it a hospice or a hospital or in the community or in a care home. You will have access to good symptom control and good end-of-life care. Next slide, please. I'd also thought to touch upon the nutrition and hydration, which is basically eating and drinking when someone's approaching last days of life or last weeks of life. Often what happens is that person's body starts to shut down. So the requirement for fluid and food does diminish significantly. What often patients complain about during that phase is actually the dryness of the mouth rather than dehydration itself. And if your mouth feels dry, there are things that we can do. Just simple sips of water or ice lollies can actually alleviate the sensation of thirst rather than intravenous fluids. In certain instances, if there is severe dehydration, then intravenous fluids can be considered. And occasionally we would give what's called subcutaneous fluids, which is less invasive. And it involves just putting needles under the skin rather than having to cannulate the patient. So there are measures that we can use to help alleviate symptoms. Next slide, please. So I'd like to end my talk just by summarizing what we have discussed so far. Palliative care is care of people with chronic life-limiting conditions. It is the main emphasis on quality of life and symptom control. It can be at end of life, but it not necessarily need to be at end of life. If you've got symptoms in the very initial stages, then we can be more than happy to be involved. It is important to consider advanced care planning if you're approaching those final months of life. It is important to ask yourself and discuss with your family as to what's important to you, what's important to your family. Symptoms can be effectively managed. And hydration, nutrition, there are options that we can consider to alleviate thirst or hunger as and when you approach the last stages of life. Thank you.
Just unmuted. Thank you for that, Ashika. That was really informative, and I'm sure that it's allayed some fears that patients and family members may have had. So that's a really good start to our evening. I'd now like to talk about some of the practical elements when planning ahead. So this talk is going to look at some of the considerations to think about when we're planning ahead. We all have spontaneous moments in our lives, but we also have those times when we need to plan and for events that may or may not happen. There's no denying that it's a difficult conversation to start and to have, but by having it early, it can allow time to create additional memories and achievements to be attempted and met. For patients, it can feel really empowering to know that someone you trust will continue to respect and support your wishes, and that you will have contributed to helping them to manage and cope at a time that's particularly stressful for everyone. It can help you to focus on the things that you want to do. And it's also important to think about other things that might be useful. So, for example, Many people put off making a will because they might have different reasons for doing so. It might feel upsetting to think about and to do, and maybe it's you don't know where to start or not sure of the right time. You might not have a focus, or you might not have the funds to actually undertake that process. Next slide, please. But the benefits of making a will can be tenfold. When you make a will, it means that all of your possessions will be dealt with according to your wishes rather than a set of rules. A will is a legal document that states in writing what you want to happen when you die. And this includes details such as who will be appointed to ensure your final wishes are carried out, and that what you want to happen to your money, possessions and assets. You can also include details about what kind of funeral you'd like, whether you'd like to be buried or cremated, have your organs donated, or have your body donated to medical research. So, what to consider when writing a will? You might like to consider who you want to carry out your wishes. This person is often referred to as an executor, and you can have more than one person to do this. It's often partners, spouses, children, perhaps. Other things that you might want to think about is actually, what do you want to do with your belongings? Is there something particular that you'd like to give to a family member? And have you got any specific wishes about how you would like your funeral to be, what sort of funeral you'd like? You know, if you wanted to donate a gift to charity, you know, those kind of things can be really difficult to think about, but they can be really helpful, so that your wishes can continue to be supported and managed in an effective way. You know, do you want to appoint somebody to act as your power of attorney, somebody who can act on your behalf? If you wanted to donate to a charity, then you can and would need to find the charity number, which you can find on various websites depending on which charity you'd like to donate to. Next slide, please. So just to talk a bit more about power of attorney, there are different processes to make, register or end a lasting power of attorney, depending on which of the 4 nations you actually live in. There are 2 main types of power of attorney. One's for finances and property, so things like paying your bills or selling your house. When you've reached a point where you don't want to make those decisions anymore, or you need some help to do those things, as you know, whilst you're still living. And there's also one for health and welfare. So that can be about preferences, about treatment, you know, where you'd like to live, those kind of things. So it can really help to plan and think about those things, about what you would like to happen in those circumstances, so that actually somebody can, as I say, act on your behalf and be your advocate. Next slide, please. So finances can be tricky, particularly when you've been living with a life-limiting illness and you haven't perhaps been able to work because of treatment, etc. But when somebody has a terminal illness, they may be able to apply for benefits under special rules. The terminal phase of an illness is often referred to as the last 6 to 12 months of life. But your CNS, citizens advice, social worker can all offer information about benefits. So it's definitely worth having a chat with them about what they might be able to support you with and provide information about. To receive benefits under special rules, you must meet the government definition of terminal illness. Under the government definition, you're considered terminally ill if your death can be reasonably expected within the next 6 months. But there are ongoing campaigns in all of the 4 nations, and it's hopeful that this definition will change from 6 to 12 months. If you are claiming under the special rules, you may be asked to send a factual statement from your doctor or consultant to the relevant government department when you make your claim. This is called a DS 1500 form, and this form provides information about your condition, symptoms, and treatment. The form would usually be filled in by your GP, but a specialist nurse or consultant can also do it. The DS 1500 form by itself isn't treated as a claim for benefits, and you'll also need to complete the other relevant forms. Of course, it's always difficult to predict how long somebody may live for, and if your doctor or nurse hasn't talked to you about it, then you can ask them questions about it, and they can actually help to support any claims that you may be able to make sooner rather than later. So it's always worth a chat with them. The main benefits for people living with terminal illness that are covered by these special rules include disability benefits for people who might need extra help with daily living, personal care, or getting around, personal independence payment or PIP for people aged over 16 or over and under state pension age. Disability living allowance for adults has been replaced by PIP. However, some adults may still receive the DLA and haven't been transferred to PIP yet. Attendance allowance for people who are at state pension age or older. Sickness benefit for when you're too unwell to work or a little to work at all or a little. An employment and support allowance for people who are ill or disabled and can't work or have limited capacity to work. Universal credit for people who are on low income or out of work, and that also supports people who are ill or disabled and can't work. Our benefits info sheet on our website might be a good resource and a good place to start to find out more. Next slide, please. So people don't want to talk about it, funeral planning, but if you do talk about it earlier, it can make things easier. How to approach it is difficult, but finding a safe place to talk and knowing when to say, actually, that's enough, I don't want to talk about this, I'll talk at another time, is okay. We talk about funeral planning, much less when we get older. It's a very British thing to be scared of death. Many other countries actually celebrate death. In Mexico, for example, they have a day every year called Day of the Dead where they gather together and pray for their loved ones. Even the smallest conversations can help your family members understand your wishes. It's not fair on them if they don't know, excuse me, what they are once you've gone. There are many funeral directors out there that can help make your funeral what you want it to be, compared to what it may have been like 10 or 20 years ago even. There are lots of different funeral options. For example, there are faith-based ceremonies, humanist or non-religious ceremonies, life celebrations, direct cremations, and eco-friendly funerals too. So it may be that you want to, just explore some of those things and have some thoughts about what you would like. Next slide, please. So the average cost of a funeral in the UK is around £3,800. 9% of people report funeral poverty, but there are some benefits available to help with the cost, and some organisations can support people with that. As of September 2021, all funeral directors will legally have to have their prices on their website, and it's really important to get a few different quotes. Don't feel that you have to decide there and then. Another option may be to, prepay your funeral costs, and that's again something that you might want to have a look into and explore. Next slide, please. The other thing to consider is how digital we are in our society now. So with more and more things becoming online, such as banks, emails, photos, you need to think about how they might be dealt with. You could have a think about a digital will. It's not a legally binding document, but it's more of a personal statement about your wishes. The important thing as well is to let your family know what accounts or emails you have so that they're not left wondering. Let people know where your photos are stored. Some precious memories are stored there and they would be really useful to share. Ensure your loved ones know your passwords or how to access your accounts, but obviously you need to make sure they're still kept securely. But it's really useful for family members to know those things so that it makes life much easier when dealing with things. Next slide, please. It's also useful to know where certain documents are so that people don't have to struggle to try and find them. Sometimes it can be helpful to keep things all together in one place. So things that might include birth certificates, your will, your bank details, and passwords. Next slide. So legacies. Legacies are more than just about money. It's often about memories, words, photos, heirlooms, stories, and traditions that people might share from generation to generation. So sometimes it might be worth thinking about creating a scrapbook that's got sayings, memories, visits, those kind of things, so that actually people can find out more information and find out those things that were particular or special to you and that mean a lot to you. Next slide, please. So we do have some resources that can help support you with trying to find out more information. Our Planning Ahead info pack can really give some insight into some of the topics that we've been talking about this evening. We'll go on to talk about in our next section of our presentation. And also it's just useful to be able to sometimes just pick the book up and put it down again if you don't feel ready. You don't have to read it all at once, but there can be some useful information about what to do, where to go, what to think about. So it may be worth having a quick peek at it. Thank you. So I'd like to now hand over to Sarabi, who'll do the last part of our presentation.
Thank you, Kim, and thanks Myeloma UK for having me. I'm one of the counsellors and psychotherapists in the hematology department at King's College Hospital, and I support patients and families with blood cancers from any point from diagnosis up to the end of life. Next slide, please. I want to start by acknowledging, like Kim did at the start, that if you've tuned into this particular talk, you've already shown a readiness to confront this very difficult life situation, and well done to you for doing that. I'm going to talk a little bit about grief as an emotional state, and then proceed to how we can support and be with loved ones who are approaching the end of life. I appreciate this can bring up difficult emotions for some people who might be listening, but I wanted to offer something to listeners on what to expect at an emotional level when either you are approaching the end of life or you're looking after somebody who's exhausted treatment options. If certain emotions arise for you, even while this presentation is happening, please know that that's completely normal. If you feel unsettled by something afterwards, then I urge you to seek support by talking to somebody you trust or through Myeloma UK or any other support channels you may use. Next slide, please. Grief is essentially an experience rooted in our humanness, in our capacity to love and to form attachments. It's the pain we feel at the loss of, or at the idea of losing somebody who's important to us. We can feel grief about the loss of somebody or about the loss of the future or life we might have had. And grief can be present before the end of life, as soon as we know that this is a possibility or likelihood. Multiple strong emotions can be present at the same time, and this can include anger, sadness, numbness, anxiety or panic, guilt or stress. It's also possible to feel fatigued or disconnected from things at some moments, but feel very emotionally distraught or upset at other moments. It's also important to remember that to grieve isn't just to feel sad or experience distress. Feelings of love and gratitude can also be present at the same time, alongside the more unpleasant emotional states, but it's also okay if this isn't the case. On special occasions like birthdays or holidays or anniversaries, the pain of grief and loss can be very acute and bring up feelings of despair, even, but a different memory at a different time can bring up different emotions. It's understandable to actually go between feeling overwhelmed or in the grip of your feelings at one moment and actually feeling okay, engaging in some normal, routine day-to-day activities, or even enjoying life at other moments. This is essentially an area of human experience in which we really can't say what is or isn't normal, and definitely can't say what is right or wrong. It's completely okay to not know how to feel or how to think as well. As you or your loved one approaches the end of treatment, it can feel difficult to make room in your life for something that hasn't happened yet, but is going to happen at some uncertain point in the future. Because it hasn't happened yet, you have to learn to live as best as you can while also holding this awareness in your mind of time being short. From an emotional perspective, the most important thing is to acknowledge your feelings, either to yourself or in a safe space with other people, including professional support if that's needed. Sometimes one or more people in the family unit or the wider network around the patient may find it difficult to accept or believe that treatments are coming to an end. This is also a normal response to what's actually a very, very huge threat. When facing something very big, sometimes what we call defense mechanisms can be activated. And for some people, this can include denial on some level at least. And they may find it difficult to accept this reality at an emotional level until it actually occurs. This is in no way a criticism or a flaw. It's simply a very different way of coping with a very painful situation. It's generally not helpful to force people to confront things they're not ready to confront, but we can try to help them towards acceptance and preparation by tentatively suggesting, this is all so difficult and painful, but I'm wondering if it might be helpful to think about certain things. Next slide, please. Actually, I'll put on this. I wanted to say that the idea of preparing for the end of life might be present for somebody at any point from diagnosis onwards. And they should be supported to have these conversations whenever it becomes important for them. Sometimes it can be tempting to delay talking about these things until we feel the time is right. But actually, whether you're the patient or whether you're somebody looking after someone with myeloma, it's important for you to have the space to talk about this and prepare for it whenever it comes to your mind. That's just my way of saying there's no wrong time to prepare for the end of life, although the amount of preparation you may want to do might vary depending on where you are in your treatment pathway. Next slide, please. Telling people around you can be painful, but all the literature and all our experience tells us that this is the right thing to do and it's the helpful thing to do. Not only does it help people to feel informed and included, but telling others can mean that you don't have to face this alone and that your support network can become part of confronting this loss with you. The idea of preparing children for the loss of a parent is a very painful thing naturally to contemplate for anyone. However, we know that children cope better when they're informed of what is happening and also when they're allowed to say how they feel about what's happening. Informing the children's school of what's happening now or what might happen soon in the next weeks or months can be very helpful also. And nobody on the outside will be able to tell you exactly what to say, but there is some guidance available. Macmillan, for example, have a guide on preparing children for the loss of a parent. There are also organizations that specialize in supporting families, including very young children, about loss. And I'll come to this in my final few slides. Next slide, please. So the end of life can also be, as Ashik and Kim said, a time to ask what's most important to you. This is a question both patients and their loved ones can ask. The answer to this question provides a meaningful focus on what really matters the most to you, something you can invest your energy in alongside the pain or the sadness or the fear you might be feeling. People are different, but many people want to find a balance between acknowledging and thinking about the end of life a little bit, but actually not thinking about it the rest of the time, and even trying to maybe stay upbeat and live their day-to-day life as best as they can. Many people, when approaching the end of life, may be reflecting on their life, what the meaning of it has been, what the legacy of it has been. It can be helpful to talk with your loved ones about your closest, most important, or happiest moments. It can be important to talk about what you've learned or what you've gained from each other, what you might be proud of. It can be useful to think about what you want to say to each other and what you would like the other person to know. These can be extremely painful conversations, but they can also be really rich and meaningful as well. Apart from the above, allowing people to talk about whatever's on their mind can be helpful, even if one of you may rather not confront it, especially if it's coming from the person at the center of it, the person who's going through it. It's not recommended to brush a conversation aside that they want to have, even if it's very hard for the people around them to hear it. There are, of course, times when different members of the family have very different ways of coping with the situation, and with some wanting to talk about death and dying and other people not wanting to talk about it. When this happens, it's important that those who do want to talk about it have a safe and trusting space in which to do so, which could be with friends and family, or it could be where counseling plays a role as well. Next slide, please. Everyone is different, but there are some things that can offer comfort to the person nearing the end of life. Keeping them company, allowing them to express their fears and concerns about dying, including, how they feel about leaving family or friends behind. And we should be prepared to listen to this without trying to fix or change the feeling that the person is expressing. Being willing to reminisce together about the person's life if this is something they want to do. Avoid withholding difficult information or shielding the person from things, because most patients prefer to be included in discussions about them. It's important also to allow people to continue to play the life roles that matter to them. What I mean by this is, if somebody wants to work for as long as they can, if their work is very important to them and they want to work for as long as they can, they should be supported to do so. Or other examples might be that you might not want to, as the loved one or the caregiver, burden the person with day-to-day news or problems like, what happened at school today or what's wrong with the car, but actually it might be important to the person to feel included in these discussions of day-to-day life until the very end. Ask them if there's anything you can do for them that'll bring them some comfort. And it's important to reassure the person that that they will be loved and that they'll be remembered. Next slide, please. So the role of counseling or psychotherapy is that it can provide a useful space to both patients and their loved ones to express and process the difficulties that you're going through. The role of counseling when someone is nearing the end of life is definitely not to fix or change feelings, but rather to journey alongside someone without judgment or without fear, and with a lot of empathy and compassion as they go through a really painful human experience. We can also support families think about communicating in a sensitive way about death and dying, and how to be with each other when you or your loved ones are facing this loss. After a death has occurred, the role of counseling is once again to bear witness to the experience of grief and help the person find ways of living with the loss. We don't usually advise people to access grief counseling immediately after a death, because this continues to be a time when a lot of practical things might need organizing. It's also a time when there might be very heightened emotions present, but these are all entirely normal and understandable. And at times like this, actually support from your informal support network, like your friends or your family, can be more valuable than professional input. And the same goes for children as well. Support from family and friends or the day-to-day anchors of their life can be more useful than immediately talking to a counselor, especially if the children are very, very young. Next slide, please. On the slide now are some organizations where you can access counseling or psychological therapy services, which includes your local hematology team, your local hospice if you're already linked with the palliative care team, and some charities. Next slide, please. Including Myeloma UK, there are other organizations that offer support to families on other aspects of planning and preparing for end of life. And on the next slide in particular, if we could move on, These three organizations are particularly targeted towards support for younger people when they're losing a parent to a serious illness. As always with any websites, I would urge parents to have a look at it yourself to see whether you're comfortable with your teenage or young children accessing it. But there is support available if you want it to deal with this issue. Next slide, please. That's the end of my presentation. Thank you for listening, and I look forward to taking some questions with the other speakers.
Thank you, Surabhi. That was so helpful and really useful to have that good list of additional resources to explore. So we'll start our question and answer session. So we've got a question in from John, and John asks, how long am I likely to have left before I get to the end stage of my myeloma journey after treatment ends? Ashik, would you like to lead on that one first for us?
Yeah, I think, well, as I mentioned at the beginning of my talk, fortunately, myeloma treatment has come leaps and bounds, so there are lots of treatment options available. However, treatment is tailored to the individual based on their condition, based on how far ahead they are in their myeloma, what treatments they've had. So what I would suggest is to talk to your hematologist, because they will know exactly what you've had so far and what options you have available. And what I would suggest is, when you're having a chat with the hematologist, find out what treatments you're going to get. What are the implications of the treatment, in that what is the hematologist expecting to get for you from the treatment? But also, most importantly, what are the possible side effects and how is it going to impact on your quality of life? This will then help you to make an informed decision whether you want to go ahead with the treatment or not. So I would definitely suggest to have a chat with the hematologist about.
Yeah, that's right. And it's just very difficult, isn't it, to predict timings with any degree of accuracy, really. And I guess sometimes it can be, reflected on how people are in terms of the symptoms that they're experiencing. Sometimes that may give some kind of indication as to how, how challenging those symptoms are to manage, which might indicate that things are progressing. But, like you say, hematologists would know best. So it's always best to go back to have a chat with them.
Absolutely.
So another question that we've had in, and Surabhi, you might be able to help with this one. We've had a question in that's from someone who says, I'm scared to talk about the end of my life and I cannot bear to think about it. And they're asking if they're wrong to think in this way. How would you respond?
Absolutely. Like I said in my talk, there's nothing wrong with this fear that this person is feeling. And thank you for submitting this question, which actually may apply to many people, but it's actually even a difficult one to ask. Most people struggle to think about and confront the end of our lives. It's, on one level, it's too enormous a thing for us as human beings to accept and take in all at once. The fear you have and the struggle you have with this is completely normal at a psychological level. Having said that, it does help to talk about your fears, because as human beings, when we feel afraid, it's our mind's way of saying, I need help, I need reassurance. And actually, the fear can be a way of you communicating what you need a little bit of support with. And so, for example, it's normal to be scared about the whole idea of life coming to an end and the idea of us not being here anymore. That's something that actually, I don't think anyone has the answer to how to face up to that. But like Ashik said in his talk, if you're afraid about pain at the end of life or discomfort, or I refer back to your talk, Kim, if you're afraid about kind of practical things and how to sort them out, then these are things, if you share your fears with the right people, they will be able to give you some guidance and reassurance so that at least some of your fears can be put to rest. With regards to the other fears about the whole overwhelming nature of death and dying, it can be helpful to actually just have a space in which you verbalize all your feelings about it without necessarily trying to change them. Each one of us faces our mortality in a way that suits us best, and there's simply no right or wrong way to do that. Anybody who supports you, including the professionals, are here to help you find your most appropriate way of confronting this issue. I hope that answers the question.
Yeah, I'm sure that's really helpful. Do you have anything to add to that at all, Ashik? Or
No, I think Surabhi's covered all of it in good detail. So I would just second what Surabhi has mentioned.
Yeah, definitely. And I think as well, it's important for people to remember there's no right or wrong way of, thinking anything about, how you might feel or what concerns you have. What you feel is relative to you at the time.
Absolutely.
For sure.
And actually, I want to go back to the people who've even tuned into this. Even that takes, you are facing up to your fears by doing that. And the other thing is not to compare yourself with sort of these perfect stories on social media of how somebody famous lived out their last days and how they faced their death with sort of peace and equanimity. Every human being experiences distress about death and dying, and there's no doubt about that.
Absolutely. Ashik, I wonder whether you might be able to answer Helen's question. She's asking, will AL amyloidosis patients receive the same care at end of life as myeloma patients?
Absolutely, yes. So palliative care is care for any chronic life-limiting conditions, irrespective of the diagnosis. So I can assure the questioner that they will get, if they require palliative care at end of life or even before that, they can easily access palliative care, and they can ask for palliative care intervention if needs be. So yeah, absolutely yes.
Yeah, that's right. It's just kind of reminding people that palliative care is about support with managing symptoms, isn't it? And that applies to any condition. So it's just important to remember that the palliative team are there to offer that help and support and guidance and expertise in trying to manage those situations and to make people feel more comfortable and more able to cope and manage with the situations that they're in. And we've had another question in, and it's from someone who says that their family think differently to them about advanced care planning, and they're wondering what they should do. And part of that question is also about whether, if they make some decisions in their advanced care planning, can they change those? Can they change their mind about them?
Do you want me to start? Well, yeah, I mean, so advanced care planning is just a technical term for planning ahead. And it is not set in stone, it is an evolving plan. So I can again assure you that if you made some plans now, and if you want to change those plans in the future, that is perfectly fine. Again, I think Surabhi and you, Kim, touched upon this, that it is normal for it's a degree of disagreement that might happen within families, and I'm sure that comes from a good place, because the loved ones might want to an example would be, a patient might not want to carry on with the treatment because they've had enough of the symptoms, whereas their loved ones might want them to carry on with that so that they can live longer. But these are discussions that you might need to have, not over a series of conversations. Again, that is where the palliative care teams, as well as Surabhi's team, can facilitate those discussions if you're finding it difficult to have those discussions. And as I mentioned earlier, if you have made an initial plan not to have certain treatments, and if you change your mind, that is perfectly fine. You can then have further discussions with the hematologist if you want to start the treatment. So they're not set in stone. They are what we call an evolving conversation. There's no harm at all, and there's no restriction to changing your mind about the initial plan.
Yes, absolutely. And again, I think it's important for people to have that awareness that, topics can be explored and minds and ideas can be changed. Like you say, nothing is set in stone. So that's why it's worth having these conversations, so that you can, consider what you feel is right for you and what matters for you, can be sort of supported as much as possible. Definitely. Another question that, sorry, Surabhi.
Kim, that it's also sometimes people feel like that they have to have clear answers in their mind to have these conversations, and actually it's okay that to not know what your preferences might be. And that's perfectly fine as well as a valid position. You don't have to, it doesn't have to be all clear in your head.
Yeah, that's right. And that's why, even though they're difficult, it's important to try and have those conversations if you can, because it just helps with that exploration, doesn't it? So another question that we've had is from Margaret, and she's asking, what legal actions and decisions should we undertake? Either of you like to start with that?
I think I'll leave it. I mean, I thought your presentation covered so much of that, Kim, and I think I'll leave it for you and Ashik to address that point. It's not my main area of expertise.
That's fine. Again, it's kind of just considering those things that are important to you. So, making a will, is a legal document, and it can be really helpful to have conversations and to have those things set in place so that your wishes and can continue to be respected and supported, and that they can be carried out as far as possible, so that you can have some comfort in the fact that actually you've helped to maybe help whoever you're leaving behind manage and feel in a much better position to be able to cope, because they know your wishes. It can be expensive, sort of setting up a will, for example, but there are some organisations that do a free will writing service. Our organisation, ourselves, work in partnership with a company called Accord, which can help to support will writing, and generally you make a donation as opposed to a fixed cost for a will, so that can be something which can help with that. But in terms of decisions that you have to make and the legalities in conjunction with that, power of attorney, again, is something that can help. Is a illegal document, and it can help to ensure that your preferences are considered, and that you have somebody to advocate on your behalf at a time when that's difficult for you, or that your condition is changing and you're not able to. So again, having those discussions and having those documents in place can be really helpful. Did you have anything else to add at all, Ashik?
Yeah, I mean, just to add to what you said, Kim, and this might not be technically legal per se, but things like social media, because we are living in an increasingly digitalized world. And it is always, again, as part of planning ahead, it'll be good to discuss with your family, or for you to think yourselves, what aspects of your social media do you want to retain? So, I don't know, Facebook photos or Twitter, and do you want someone to have control of it, or do you want to delete all of it? And I think, Kim, you mentioned in your presentation about passwords, password of phone or bank details. If you do want them to be, one of your family members to have them, it's best to have all those decided and planned ahead. May not technically be all of them may not be legal, but still have legal implications in the future.
That's right. And even things like ensuring that if you have a bank account, whether that bank account is in joint names and things like that, so that actually the other person would be able to access it. So things like that might be worth considering for sure. So yeah, but I mean, it's difficult, and it does feel like a minefield, but sometimes just taking some time to write down those things and talk to your team about those things, talk to your family about those things, it can help you to come up with some answers and a plan to move forward, and it can definitely feel very empowering to know that you've sorted those things out. So if you can think about it, it's worth it, because it can make things a lot easier. So just moving on to our next question. We've had a submission in that says, if I have palliative care, does that mean I'll no longer be seen by my usual care team? And who will know about my myeloma? you want to start with that one, Ashik?
Yeah, yes. I can assure you that just because palliative care team is involved does not mean you have to stop seeing a hematologist or any other specialist for that matter. Usually what happens is palliative care teams are involved to assist the hematologist in terms of symptom control, or just like we discussed earlier about advanced care planning. Often these go hand in hand. 30, 40 years ago, palliative care was dealing primarily with end-of-life care. But as I mentioned earlier, now palliative care is involved from the very onset of the condition. So sometimes you may be diagnosed with myeloma following admission to hospital with severe pain. So palliative care can be from the onset or even before the confirmation of diagnosis, but go alongside your usual treatment for myeloma. So you will still have your hematologist looking after your myeloma side of things, while the palliative care team looks after your symptoms. And as and when, let us say, the patient is approaching last days or final days of life, it may be appropriate to then to palliative care to have an even bigger role to improve your quality of life and provide a good end of life care. But definitely, hematologists and other specialties will continue to be involved in your care, even if palliative care is involved.
That's great. Thanks for that. So we've just got time for one more question now, unfortunately. So we've had a submission in again from someone who's asking, what can I do to prolong my life so that I can have more time with my family? I always hope that there will be a treatment soon that may bring about a remission for a longer period.
You want me to make a start?
Yeah, if that's okay.
Interesting question. I don't think I've got all the answers, but you are right. There are a lot more treatments currently happening. Again, it'll be a hematologist who would know what the latest is and what would suit you, what would suit your condition, and what would suit you based on what your overall fitness level is. However, what I can say is we do know that sometimes symptoms like pain or like the side effects of treatment can stop someone from carrying on with the treatment. So, and that is where, if let us say, if it is pain or if it's sickness from the treatment or if it's fatigue from the treatment that is making you having to stop the treatment or delay the treatment, this again is another opportunity where palliative care can actually help improve compliance to your treatment and thus improve prognosis. So, so again, I just want to emphasize the fact that if it is if it's side effects that's causing problems, the palliative care can help improve treatment compliance and thus prolong your life.
That's right, and it can help you make feel a bit more comfortable. Actually, I'm just going to squeeze in one more question, if I may. So the question that I'd like to ask that we've had submitted is, how do you, and this is really, if you could sort of start on this one, Sarabi, how do you judge if someone wants to talk about planning for end of life? Do you wait until they bring it up, or would you ask them if they were thinking about it?
Thanks, Kim. I think it depends on each person's readiness and what's the thing that needs to be talked about. Generally, like I said in my talk, if there's not any urgent matter that needs to be organized at a practical level or dealt with at a practical level, I believe in giving people space to bring things up as it occurs to them and not forcing the conversation on this. Equally, if there's something important or meaningful that you want to communicate to the other person, whether you're the patient or whether you're the person around the patient, then doing that is in your hands. And you should feel free to say what you want to say, and generally you'll feel better for having done so. If there's a practical thing that needs to be organized or a question that needs to be answered and you're not sure whether the person is ready, it's okay to bring it up tentatively. I might open with something like, I'm just checking how you're feeling, with knowing where we are with treatments. And then maybe you want to ask them, is there anything on your mind that you want to talk about? If you want to discuss how they're feeling emotionally about it and you're worried that they're bottling things up. Or if it's something practical, it might be that you say, I'm wondering if it would be helpful to, and then you can fill in the blanks with whatever the question is, for us to discuss our finances, or for you to tell me what your wishes are. It's also helpful when we have these conversations to acknowledge how difficult it is to have them, while acknowledging that it might be helpful to have them. So I might say something like, this is so painful and I really wish we didn't have to do this, but I'm wondering if it'll help us as a family to talk about this, and actually leave it at that. Because sometimes it helps us get there when we acknowledge that we really don't want to be having this conversation, but it might be helpful to do so.
Absolutely. Well, thank you both for those responses to those questions. I'm sure that that's been really helpful for the people that have sent those in to us. So thanks very much. I'd like to highlight some of our resources from Myeloma UK, which you might find helpful. But before I do that, I'd like to give you some take-home messages. It can be scary to think about the future and what happens after you've gone, but planning for it now can allow you and your loved ones to enjoy the present, knowing that your wishes are understood and that things will be taken care of when that time comes. So some of our resources and support that you might find useful, we've obviously got our Myeloma UK info line, which you can call anytime if you've got any questions, worries, concerns, or, as I've said earlier, just to share your thoughts out loud. Sometimes that can be helpful. We've got some really useful publications on our website, and we've got some support groups which many patients and family members find useful. Unfortunately, at the moment, they aren't meeting face to face, but a lot of them are meeting virtually. So if you would like some details, please do get in touch with us. We run our info days and digital sessions online, and hopefully once all the restrictions and things go back to normal, then hopefully we'll be able to meet again in person. Please do keep an eye on our website for details about those. We do have a range of online videos as well, which again have some sessions about how patients have experienced something. We also have clinical nurse specialists and other health professionals sharing their expertise about different topics. So again, you can access those on the website. And in addition to that, we've got an online forum where patients can actually talk to each other and share experiences. So sometimes if you wanted to ask a question and find out how somebody else might be managing or experiencing that situation, if you register on the website, you can post a question online once you've registered. So that might be really useful to think about and consider if you wanted to find out how someone else might be managing something. So thank you again for joining us. We've come to the end of our webinar, but thanks also to our supporters. Myeloma UK is able to provide these free digital events like this one for patients and families, but that's only because of all the support that we get. If you'd like to support the work of Myeloma UK, please visit www.myeloma.org.uk/donate. So thank you again both to Ashik and Surabi for sharing their expertise and answering the questions for us this evening. It has been a very sensitive topic to cover, but we hope that it's given patients and their loved ones a better understanding about end-of-life care. Thank you also to our technical and behind-the-scenes team and to everyone who's joined us this evening for the webinar. We hope that you found it helpful and informative. I'm really sorry if we didn't manage to get to answer your question this evening, but if it has thrown up some new questions, please do get in touch with us. You can do this via our info line or Ask the Nurse email service, and details of which are on the screen now, and also our website. So please do keep an eye on our social media and website for announcements of further digital info day sessions. And once again, I'd like to thank you all for joining us, and I hope you enjoy the rest of the evening. Good night.
Thank you. Bye-bye.